All right. Looks like we're good here. Scout sign, scout oath. On my honor, I will do my best, do my duty, God and my country, to obey the scout law, to help other people at all times, and to keep myself physically strong, mentally awake, and morally straight.
One suggestion for everybody real quick, as we start with these, one of the things that we noticed from last week is having so many people with so many different delays on there, it's kind of hard with all the echo effects going on. So as we do common things like the scout oath, the scout law, the pledge, we'll let Sam or whoever he delegates out for leading that speak. Probably going to want to keep yourself on mute so we can actually get through some of the stuff. Sorry, Sam, go ahead.
It's all right. I guess we're doing the pledge now. We don't have a flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. All right, you go ahead.
So just to kind of recap quickly what's going on today. All right, somebody needs to mute.
Your stuff, guys.
All right, there we go. Much better. All right, just to kind of recap quickly what we got going on today is Christian will be working with some of you guys that still have outstanding pieces for medicine merit badge. But today the main intent is to, one, to knock out another C-based learning module. And then also, once that is completed, we'll begin the first requirements and all that for public health merit badge. Ironically enough, and all of everything going on, it's kind of fitting. So, Sam or the other scouts, leadership, any other questions besides Charlie? What's that, Charlie?
Just for the people who sold peanuts, the order has come in. I need to separate them, and then I will be calling you individually and letting you know about pickup. I realize you cannot deliver them, but if they're family members, then you get your stuff. But all right, just wanted to let you know about that.
C-base. Who's doing C-base?
Eli Snyder and Caleb McElwee.
It doesn't really change. It doesn't affect you. I turned it down to slow.
I think the interference we're having. Actually, New Year's is an over
Yeah, Christian, I think the issue is it's picking up both of your mics in different rooms still.
I'm going to switch with Eli. He's going to sit here, and then I'll come back when he's done, because we're between the three of our things. That's the problem. Yeah. So, yeah. Well, I don't know. Just you guys start. And I guess him and Caleb can just go back and forth, because I would imagine they both outlined things from the handout. So is that what you guys were thinking? Is Caleb there?
Yeah.
All right. Good.
Who's starting?
Who wants to start?
He can.
Okay, go ahead.
Okay, so
what's the topic?
A marine head, which is what a toilet is called on a boat. And so some of the differences, a head on a boat is smaller than a regular toilet that we would use at a house, and it's smaller, and the pipes are also smaller, so nothing besides like just regular waste can fit in it. So like instead of we can't flush the toilet paper down. We have to put it in a trash bag and hold it in a trash bag. And instead of flushing, you have to like pump the waste instead of flushing. And you shouldn't be standing when you're going to the bathroom, because if a wave hits the boat, you can make a big mess, and then you'd have to clean that up. So yeah, that wouldn't be very good.
Everybody has to.
Sit down when going to the bathroom.
All right, Caleb, do you want to go?
I think I'm pretty sure he covered everything.
Nice.
All right, so just to interject a little bit, when we're looking at this pumping system, for any of you that have probably had either like an RV or been in a camper of some sort, it'll have like a foot pedal at the base. Some of these might have a foot pedal like that where you have to pump them, but the way it sounds, the way they explain it is you're going to have to hand pump this. So you're going to be getting down close to what you were doing. So, it's important that we cannot stress enough that while it may not seem manly to have to sit down to use the toilet, the fact of the matter is that that's going to be the safest, cleanest, and less mess for you to have to clean up. And I will tell you that anybody that's going to be on these ships, that's going to be watched pretty closely. So if you didn't make the mess and you find it that way, there's a good chance you're going to get blamed for it and have to clean it up. So if you don't want to be that guy, just clean up after yourselves. Most of you guys aren't real big guys, so I think you'll be fine with that.
And so, Caleb, to emphasize that, is there any air conditioning or kind of airflow that's going to be in that toilet, you think?
No.
So if people start peeing on the floor, what's it going to smell like in a few days?
Strawberries.
Pee.
Really bad urine. Yeah.
Mhm.
And we all have to step in that and move around in that. It's going to be like a small closet, if that.
Yeah.
All right. And then, Caleb, you want to talk about maybe some TP type stuff? I know Eli touched on it.
Okay. So whenever you're going to go to the bathroom, you want to sit down, because if you stand up, then it's going to go everywhere. Then you're going to be the blame for it. Then you're going to have to clean it up.
That's right.
And you don't put the toilet paper in the head, and if you do, it might clog it. So then you're going to have to tear it apart and clean it out, then put it all back together.
That's no fun either.
Mm-hmm.
One quick thing. Please, if you have an accident, come and let one of the adults know. Just don't go away and figure, well, if they don't catch me, nobody will know I did it. Okay? The worst thing you can do to your fellow shipmates is have an accident and don't let anybody know. Let one of the adults know. We will help you if you need help, okay? But if you have an accident, whether it's your puke up or it comes out the wrong end or you got diarrhea or whatever, please, please, please let us know. It's better to get it cleaned up when it happens than wait until somebody else goes into it and then discovers that they're stepping on whatever, and it just compounds itself. Do not be afraid to tell one of the adults that an accident has happened. Please.
Thanks, Charlie.
Yeah, we'll only throw Charlie overboard for that. The rest of you we won't, so just be honest.
And just remember, fellas, when it comes to toilet paper, we're putting it in a trash can. So it's not laying on the floor. There's not a separate container for it. There's a trash can container that you'll be putting that in. And I would imagine, making sure that we don't need to have enough toilet paper to mummify somebody here, but we definitely need enough to take care of business and then probably fold it on itself to put it in the trash can. All right. Pretty good. Anything else, Jake?
Yo.
You have anything else to add to any of that?
He just woke up.
I did not just wake up. I've been awake all day. I've been awake since like 8 in the morning. The only thing I could add is it's still a toilet. Just sit down when you go to the bathroom and suck it up and put your toilet paper in a plastic bag. It's not that big of a deal. That's all I have to say.
Well, but it should be easy, right?
Matt?
Good. Okay, good job, guys.
Matt,
Yes.
I have a question.
CV, good job.
Are we even going to Seabase? Do you know?
At this point, okay, so my guess, okay, the way I'm viewing this, and I have nothing to support this, the last they told me 2 months ago, a month and a half ago, nothing had been canceled. All right. Domestic travel has not been stopped. It's been slowed, but it's not been stopped. And this is domestic travel. So we are probably looking at, we should be going. I don't see any reason why we're not yet. They're talking about opening things up and releasing some of the restrictions in our towns and communities, and so that's going to make it a little simpler. But you know, we just need to stay as safe as we can and follow the rules and regs that are given to us. And when the time comes, we're going to be, you know, full ahead.
I think we'll know more by the beginning of May.
Agreed.
Really.
All right. Thank you, because my mom, like, really wants to know. She's been asking me to ask it.
Yeah, I know. I get a lot of questions about it, but I think we should be good to go. Any other questions?
Dylan Beaver has a question.
Go ahead, Dylan.
Wasn't all like aerial travel stopped a while back?
No, that was outside the country.
Oh, okay.
Outside the country. So St. Thomas is still part of the U.S. and that's domestic travel is what they call that.
Matt, I think part of the question is with the stay-at-home orders that most states are under.
Well, so I'm not sure how that's navigated. I think that, you know, you're not, it's not that you're not allowed to leave your house. I mean, some places are being that strict, but I don't think that's going to be an issue for us in June and mid-July.
You know, like I said, I think everybody should just wait until beginning of May and see what kind of introduction of some limited back to work and whatever's going to happen. So I think we just got to wait. I don't think Matt can really give us an answer right now because we just don't know yet. But I think we should look to a possible or probable chance that we'll be able to go. So.
All right. Anything else? All right. Short and sweet today, fellas. Good.
All right. Good. And then next week, what I have on it is Noah and Lucas doing required knots. They have the next 2 meetings. That's what I have on the schedule.
Yeah, you're right, Christian. And just a point of order for everybody. Be a good plan to have a 6-foot piece of rope or cordage with you for our next meeting. That way you can tie knots while we're all tying knots together. Okay?
So Noah and Lucas, you guys can FaceTime at some point then and go over those knots together. Okay, good. Good job, guys. KLPLI, good job.
I like the beach, Noah.
Okay, any other questions for C-Base? Are we ready to move on? All right. All right, Public Health Merit Badge. All right, so I think this is really, like Tim said, a really good time dependent merit badge with everything on. There's some things I'm going to cover about epidemiology and other things that are in it. I'm also going to touch on some of the different virus outbreaks towards the end of it, that I'm going to cover some additional things. That's not on a requirement, but I think it's good to go over some of the information and data. So I'm going to expand it a little bit, go over a few things that maybe aren't just in the merit badge that I think are so important for you guys over the next few weeks, just to understand how this came about and how we can maybe look into changing the way we do things in the future. You know, so anyway, because there's a lot of CDC ties in this merit badge. I use a lot of the websites from the CDC for this, so I'm going to reference that quite a bit during this discussion. So first of all, the general description of what public health is. And public health, one definition I found: the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private, and community and individuals. One thing, it's considered a branch of medicine dealing with public health. This includes three categories: hygiene, which is overall cleanliness; epidemiology, which deals with both the incidence, distribution, and control of diseases; and the third point is disease prevention. Those are the three subcategories that the basic public health is responsible for. They kind of break it down into a triad of coverage. They go over assurance, assessment, and policy development. Under assurance, it talks about enforcing the laws, linked to provide care, which over the last several weeks, we have constantly from the CDC been getting links, downloads from local hospitals. I've been inundated probably with 4 or 5 different things every day at my office. They talk about how to ensure competent workforce and also then to evaluate. And those three things constantly go in circle, those 4 categories. For assessment, they talk about monitoring the health, diagnose and investigate, and then on to policy development is inform, educate, improve, mobilize community partnership, and develop policies. And again, this starts going then into the assurance, which is enforce laws. So the main thing for public health is they want to monitor, they want to come up with plans how to improve it. And then afterwards, along the whole process for this contagion is occurring for the coronavirus, they're constantly looking on ways that it's constantly a fluid situation, how they can improve testing now, coming up with diagnosis, and for the future, how we can start coming out of this isolation type procedure. So this is really, you're seeing the full public health system in full force and work right now, which is really interesting because all these things are coming about. And these numbers and sources, these calculations are constantly changing. Now we know the infection rate for, as that grows, there are people that are clearing the disease, and the death rate that was initially calculated was way over the top. And now we know that number is going to be down as long as we continue this line of treatment. And that's why they're thinking about once we get past this peak over the next few days, we might be able to start lifting some of those sanctions at this point, which I think be important both for people not being nervous and for getting back to a lifestyle for the economy. So that's what public health is basically evolves around, is this circle paradigm that continues flowing with all that, both with policy. And so you have basically lawyers on it, and you also have doctors that work for the public health. And there's a whole core of different people that come up with different policies through that process. So I wanted to touch base a little bit on how diseases can spread. We're going to talk about vectors later on and some other things, but some of the ways that things can spread is it can be through aerosol droplets, which we know this coronavirus is being spread. It can be through direct contact with touching with the virus on your hands, but you also know this can spread. Then we talked about other sources that's just in general diseases such as contaminated food, which we're going to go over some diseases that come about from food such as hepatitis, contaminated water, which has been various different diseases that cause diarrhea over the years, and also vectors. And as we know, vectors are basically a mode, is a carrier that carries one disease off of either a human animal into another person, which causes infection. And in the sense that, you know, we're still looking for the vector, the main vector for this disease. There's still some not complete certainty that it did come from a bat or from another animal at this point, and we're still looking in that investigation. So until we find that vector, we're not 100% sure how this disease actually started initially, which is an interesting discussion at this point. So that's how diseases can spread. So I skipped ahead a little bit. There is a question, what is a vector? A vector is an organism that does not cause disease itself, but that transmits infections by conveying pathogens from one host to another, serving as the route of transmission. To understand that, some of the most common vectors that have been from years and years ago was the common mosquito. We see that on different diseases such as malaria. We look at common flies, all different kinds of flies that can occur. A common one, the tick, which causes Lyme disease, and also other diseases that the tick can actually spread. We look at parasites and worms that can spread from other underdeveloped countries. If you go barefoot in certain areas, worms can spread that and spread parasites with it. They go back, when you go back to the bubonic plague, we've talked about that. And what a lot of people thought that it was actually rats was the case in some cases, but actually the biggest spread of the rats was the fleas that were on the rats that jumped from human to human. So fleas, they believe, was actually the more common organism because, of course, fleas draw your blood and they would jump to another victim and spread it. And they felt it was spread by the fleas coming from rats, from human to human, and from humans, because the hygiene at that point was very poor for the general population, where it started over in Europe and then spread to the whole world. So just that tiny little flea was a vector. And the same with Lyme's disease. I know a lot of people that are completely devastated with some of these more aggressive forms of Lyme disease, and that tick is so small. So it's amazing how these vectors can cause disease. So understanding how these transmit and pass is something public health has a lot of issues with, and understanding how these diseases got spread, but also historically how they're going to prevent them from spreading in the future with it. So controlling diseases in your home and community and at camp. In our home is some of the way that we can possibly do it. Proper trash storage and disposal. Prompt disposal of pet feces. Eliminate standing water, old tires, poor drainage gutters, natural puddles and pools. Removal of debris and weed overgrowth, such as wood or rock piles, construction debris. Make sure your home or business is well maintained and no opening for rodents to get inside, all right? At camp, some of the things we can do at Boy Scout camp. Keep your tent and campsite clean, not boy clean, or more of us says what we call maybe mom clean. So when you're letting all that dirty laundry around, all right, that bugs and critters can get into, or it's growing fungus and other things that's growing on it. Also, if varmints come in, if they're attracted to the food source, then they're going to carry diseases. You know, we always talked about animals coming in. Well, those can carry certain diseases as well. So that's the one thing, of not keeping them out of your tent. Proper trash storage and disposal. Practice leave no trace. That's the easiest thing to follow. It's just keep it as clean as when you found it, and that's how you're going to leave it. Leave the cabin doors open and windows closed to avoid mosquitoes and unwanted animals, and check body and clothing for ticks. So those are some of the things between your home and where at camp or at other areas, and how you can reduce. And a lot of this is reducing the vectors, which then are spreading the disease, which is more indirect, but does lead to those diseases. So I wanted to talk about that. All right, and having a messy tent is not something that looks like cleanliness to me, so keep that in mind. All right, so we're going to move on to now. All right. So let's talk about now some diseases. And if you guys were following with the handout, we're going to talk about E. coli, tetanus, HIV and AIDS, malaria, salmonella, and Lyme's disease. So these are some of the things that we're going to cover. The first one we're going to talk about is E. coli. I'm sure everybody has heard of E. coli. Now, E. coli naturally occurs in the body. It does belong in our digestive system, but that's what's called good E. coli. That's one of the organisms that helps you break down bacteria. When E. coli gets to be a bad form of the E. coli, you get food poisoning, and also E. coli in your urine can cause a urinary tract infection. So some of these bacteria are good in our body and can be normal in their growth, but in E. coli, when it's in food, it's very bad. That's not what you want to see growing. This is one, E. coli is found, again, in the human and digestive system. It also actually helps us produce a certain type of vitamin K in the digestive system, which is good for vitamin K. But when the strains are bad, then they have the ability to produce toxins. The toxins, it's what makes us really sick, which gives those GI symptoms of vomiting and diarrhea. Some of the more common causes of them is food processing is typically the most common of food poisoning with E. coli. Usually it can be in a butchering facility or preparation processing. One of the common things you'll usually hear with an outbreak is because usually if somebody's doing a meat product and then they process plants or vegetables in that same area before they stay cleaned or sterilizing that work area. And that's where a lot of the E. coli will come. We'll go from meat to fruit and vegetables. And that laces on us when you're keeping it refrigerated, it's at a low growth. And then if you don't cook it thoroughly enough to kill that bacteria, it'll actually make you sick. And freezing it doesn't kill it. When you unthaw it, the only way freezing will do it if you do it like minus like 100 degrees Celsius, which is basically like freezing bone. That's when there's times where that can kill it. But other than that, just a normal freezer isn't cold enough to kill that. So if you have food that's contaminated and you freeze it, when you thaw it, it still has the same bacteria. And in fact, usually when it gets unthawed, it's going to grow and replicate even faster, which causes even a higher infection rate in most forms. And if that food doesn't get cooked properly, and that's why if dad's grilling, he usually is checking the meat for a certain temperature. Most meats vary between pork to meat products, but a lot of times that's why you use the temperature gauge to check that, and we'll talk about that a little bit more. All right. Also, it can be, and other things is if you hear about E. coli outbreaks, warm swimming pools or mostly ponds. E. coli outbreaks are there. I know Pinchot Park actually had some outbreaks of that a few years ago, and they had to shut it down. And you can kind of do the math. Why? Because people were peeing in the pond too much. So a lot of times when you guys are swimming in these places, you're not supposed to go to the bathroom in the pool or the pond area. Please go out and go to the bathroom. If the water's stagnant and doesn't have a lot of natural water springs, and it doesn't circulate a lot, and it's very warm at certain times of the year where the temperature goes up, the E. coli will thrive. And when they test it and it's too high, they have to shut it down because it's a public concern. So they'll usually do a shock treatment. They have to let it sit for a while, and then it's okay to swim again. So that's why that thing gets monitored on a certain times of the year. Okay. So the pathogen E. coli, the ones that are bad that cause disease, it is a form of bacteria. It's a gram-negative rod that we look under a microscope. We can tell what type it is in a laboratory. There is no vector. It passes directly. Once it's on the food source or in water, it passes directly to the human, and it gets them sick in their GI system. It doesn't need something to carry it. Methods of prevention, well, we talk about preparing food. Keep meats away from food. When I go on our scout thing and I do the cooking, one thing I always try to do is I keep the meat sources in a cooler separate from fruit and vegetables. That's a good way of doing it. You're also supposed to keep chicken and red meat separate as such. I try to use a different flipper on the grill. Now, once the meat is fully cooked, then it's fine. But in the process, until it's fully cooked, you should try to isolate it. But the main thing I usually try to do is keep it on the scouts. I want to keep different meat products away from the fruits and vegetables. Because when a lot of times when you get those containers, you can even see that there's juice in the bottom of the cooler. Sometimes those sealed containers leak, and that will get out. And in that juice is going to be that bacteria. And if it's allowed to grow, it can cause illness. And also when you cook it, a lot of people say 160 degrees, and that'll vary from meat to meat. If you look at cookbooks, they always have temperature that they consider to be at least medium done or higher than that. Available treatments usually when you get an E. coli infection, there isn't, for certain things, antibiotics for urinary tract infections However, for some of the gut bacteria infections, antibiotics don't work as well. A lot of times you're using more anti-diarrheas and you're using hydration and fluids that you don't get dehydrated, but a lot of times you got to just let it move out of your bowels at that point. You should be hospitalized if it gets severe. For elderly people immunocompromised, it can become a significant, but most of us just get usually throwing up and diarrhea. Diarrhea is the most common thing for E. coli, and you just need to let it pass. All right. Kidney failure occurs in about 5 to 10% of cases. It's not that common, but the times that I used to see it in the emergency room is people that were already dehydrated to begin with. They had been throwing up for some time, and you really got to get hydration or their kidneys will shut down, and that can lead to a real dangerous condition. So that's where it's important with that. And I always say to people that if you're sick and you throw up once or twice and you're still producing urine, when you're severely dehydrated is when you are not going to the bathroom and you're producing no more urine. That means that your body has shut down. Your kidneys now are retaining all the fluid in your body because you're too dehydrated. And if you're not going to the bathroom, you do need to go to the hospital and get IV fluids. So that's the best way of doing it. If you're getting sick and still producing urine, you're probably going to be okay. But once that urine stops and your symptoms continue, you need to get hydration and fluids. So keep that in mind. All right, let's talk about tetanus. All right, the organism that causes this is Clostridium tetani. All right, the common term tetanus we always heard is lockjaw. And the reason being is the organism that produces this toxic outcome, it attacks most of your neuromuscular connections. So the muscles go into a really strict rigidity. Your rigidity, your thigh muscles, your calf muscles will get very tight. And you don't always see the typical lockjaw thing in the mouth. I've a lot of times seen it in some of the larger muscle groups as well. We had some case up in New York that someone was pretty sick and they were actually getting where their face was tight. They looked kind of like they were grimaced and they were actually couldn't relax their knee and their legs. And that was a case that we saw up there. So we had to admit them and we had to do tetani treatment for that. This is an environmental bacteria. And what this does is rust hides this bacteria. The tetani bacteria cannot thrive well when there's around oxygen. It kind of is tough on the organism. So it likes the environment that the rust seals over the product. When you step on a nail and that goes into your skin, the rust gets pulled off and exposes the bacteria, which gets released into your tissue. And that's why rusty nails are the most common source of it. It can be any kind of metal or outer projects, even wood can do it, anything that breaks into your body. But most of these organisms live in kind of the environment or on the earth, and they're usually away from the oxygen. And once they start growing and replicating, though, then they cause this infection. This goes back, tetanus was first described back, all historically back, Hippocrates back in the 5th century BC. So this has been diagnosed and treated for a long time. And this was actually also still a common condition in the Civil War too. And so we started getting antibiotics in the early 1900s. This condition was considered very life-threatening. And it can lead to death if not typically treated. The characteristics again are usually severe muscle pain and stiffness, difficulty swallowing. All your upper swallowing muscles are usually hampered by this. So some of the early symptoms can be, I just can't swallow, doctor, and I can't smile. Also, we talked about muscle spasms. These muscle spasms can be so bad that they'll start tearing tendons and the attachment, and they actually can fracture bones. That's how some of these cases have been documented, where they came in and they had multiple stress fractures over their body for how rigid it gets. It's pretty significant when you see a case of it. I'll never forget the case that we saw. So we talked about the rusty nails, low oxygen environment, and rusty nail acts as what's called a fomite. This is basically something that helps transmission. It's a product that holds the bacteria and then transmits it there. So it's not a vector, but it's just something that holds the organism in it. 10 to 20% of those infected with that do die, and there's still cases in the United States because they just go in and get treatment. And I get diabetics who a lot of times will step on a nail and end up getting a foot infection. And it's amazing to me the amount of them that are luckily enough they have it. The best way to prevent it is when you get your tetanus toxoid as a kid, but you have to really do that as an adult. If you're somebody that works around outdoors, I'm sure Robinson, you probably get your tetanus, get checked on that. And if not, you probably should if you're out in the field. But a lot of times people, they recommend for people around those kind of objects about every 10 years is that should be updated in the field. All right. So we go to the next one. So again, tetanus is a bacteria. It's caused by gram-positive rod. That's a type of bacteria. Puncture wounds or even dirty objects that do it. And a lot of times even animals. If animals, you never know what they're eating or chewing on. Sometimes animals chew on wood products that can carry this bacteria. It's not going to stay in their mouth very long, but it is a possibility. Sometimes bite wounds in the emergency room, we would always get people given tetanus, even if they had bite wounds. If they weren't updated in some time. Methods of prevention, we talk about that, childhood vaccinations, booster shots every 10 years as adults is what they're saying on that. And if you suffer a deep puncture or an injury, now again, this isn't a superficial cut. However, if you're using rusty knives, then that's something you are at risk for. But typically they're puncture because it goes in deep into the skin, and when it gets pulled out, it leaves that bacteria in the skin. So puncture wounds are the most common cause of them. If you're using, clean kitchen knives and they don't have rust on them, you don't have to get a tetanus shot typically if you're dealing with that. But it's something they ask you if you're compromised and it's been years and years. You never know. Sometimes they will. But that's not a typical treatment if it's not considered a rusty object. We talked about the different. There's a tetanus booster, and there's also the tetanus immunoglobulin and antibiotics. So if you actually get tetanus, what we did is we admitted them, and you actually get booster shots, which are very painful for this, and then you have to go on antibiotics. They say the tetanus shot of the immunoglobulin, which is an active immunoglobulin treatment, they say is really painful. So you won't ever forget doing that again if you don't keep up on your tetanus. And that is, again, and those percent of the cases can cause the death. Now we talk about HIV or AIDS, which is acquired immune deficiency syndrome. This is caused by a virus. Yeah, Robinson.
All I wanted to say was a lot of times, fellas, you guys get your yearly physicals. When you become adults, you need to stay on that yearly physical schedule, and your doctor is going to look at that. In fact, you were asking about me and getting tetanus shots because I do try to pay attention to that. I think I was 1 year away from needing a booster, and she was like, no, the dates didn't match up right and at a physical, and she caught that and gave it to me, right then and there, because it can be pretty nasty. So you don't want to mess around with it.
And if they don't have a record, a lot of times we would ask people, and if they say, I can't remember the last time I had one, we usually just give it to them because it really doesn't hurt to have another booster. But if you get tetanus, again, 10 to 20% of people can die. So if it's left untreated. So, and those immunoglobulin shots, again, are very painful treatment. So it's not what I recommend going through with it. So good point on that, Robinson. All right, so for AIDS, again, this is caused by the virus. And the interesting thing, if you look back on the data, I remember back in the 80s, doctors and the CDC were really confused what this disease was. They know that it was attacking the white blood cells in our body. They figured out it was some type of virus, but it took us a long time to get a grasp on this disease back in the 80s. They do relate. I mean, there was even some theories that it came from monkeys, and I mean, they were just all over the board in the early stages from this disease with it. But eventually it was known that it was a virus, and basically what it does, it attacks a certain type of your white blood cell system, which is your white blood cells fight as your fighters for your immune system. So when you attack the cells, the very cells that help you fight infection, this is why once it blew up and your white cells got to a low level, you can't fight any kind of infection. And this leads to a lot of different diseases that normally we fight every day. This can be the simple diseases that most of us don't even know about. You become susceptible because you have no immune system to fight it. And then you're susceptible to what we call opportunistic infections. This is spread from person to person. There's no vectors for this. Usually, most commonly, it was for unprotected sex for a lot of individuals when it was starting. But also it was spread by needles. When the drug things were really on a high uptake, such as heroin and things like that were needle derived. A lot of those drugs back then were brought in by needles, and a lot of people shared needles. In these drug houses, they would use the same needle because hypodermic needles sometimes were hard to get a hold of. So you'd have sometimes 5 to 10 people use the same needle to inject themselves. So if one person got this disease, you basically all got it after sharing needles. And that was a common thing, that education had to be expressed even to drug users about this disease. It is bloodborne, and the thing of it is, it's like if you have an open area and you're exposed to the blood, you could pick it up. One thing dentists were really concerned about it is we were doing surgery. We had to treat every patient during the later in the 90s that anybody could have either hepatitis or AIDS. So that's why we had to be very careful. If a glove tore, we had to change the glove, not just for sterility issues, but for these type of diseases. So this was something in the 90s that was really a big deal in the health field with it. And the big thing for me when we were in training is when we were given injections was getting stuck by a needle that was in somebody else's body. And this was the concern of ours. People that drew blood, started IV lines and all those kind of things. So this was a big deal when I was in a hospital setting back in the 90s. Also, the other thing is it can pass to a child from a mother at birth. And they weren't sure about it, but by the time they actually found, even from breastfeeding, they were feel that if a mother had high levels and wasn't under control, now with some of the new medications and treatment, they're keeping the numbers that are basically at 0. And this is basically almost being eliminated now in the United States because of our ways of now fighting the virus symptoms. And what it basically does, the medications, it stops the virus from replicating, and it can't get into our white blood cells anymore. So the virus fizzles out because it doesn't have the white blood cells to replicate. And the other thing was too, when this disease wasn't being detected, was blood donations. There was a lot of blood banks until we find out about it. It was a big concern because there was some cases where some people did get the AIDS disease due to blood transfusions, which was a concern, which is now our testing of that blood is so much more superior than it was years ago. So again, this is a virus. There is no vectors in this. It goes from person to person by blood or different types of blood transmission. One of the things, message of prevention is, again, is abstinence. I always talk about youth, and we're going to talk about that. Some kids with that is, unprotected sex. You got to keep that in mind. These are diseases that are going to pass, so we're going to talk about them. So everybody's got to put on their adult pants for some of these discussions. It's important to talk about it. Don't use illicit drugs, heroin, needle drugs, all those kind of things. This is a good reason. A billboard, don't use drugs. Can't emphasize that enough. Also, different exchange programs where they're sharing different things that maybe could have blood on them. Let's say if you work with a coworker and you got a bad cut and there's blood all over a pair of gloves, don't go and use them. Those are things, if you have open cuts and things like that, those are something back in the 90s we had to learn over time. And also now with the testing of blood so it doesn't get transmitted. There's no vaccine or cure. We can, but the medical treatments have gotten so good now that basically what they call a viral load, the viral load can be kept at basically 0. So these people now can live healthy, normal lives, and they now will die with the disease, but not of the disease because of superior antiviral medications that have been produced over the years. And that's why and those numbers get so low, you're not even going to be able to spread the disease at this point. That's how low those numbers are with it. So, okay. The main thing and also some of the treatments is geared to some of the opportunistic infections that you normally wouldn't pick up if you have a good immune system. So you got to treat those. When I was in Philadelphia, we would admit people with this, and we had to know all those rare diseases that usually were in third world countries. All of a sudden, these people were picking up around cities like Philadelphia and other larger metropolis areas. Encephalitis is another thing. It's not on the list, but it was something that we're going to get into with different meningococcal infection, things like that. This talks about head, inflammation, organ, and tissue. And basically what this is inflammation or infection that involves the brain or the spinal column with it. The incidence reported about 7.5 cases, 100,000 people per year in the United States. It can occur at any age. The inflammation damages the nerve cells, and basically you get what's called an acquired brain injury. your brain infection gets so bad it just becomes like a puddle of water with all this infection mass in it, and you do lose brain function. And this does, when it gets to the higher stage, it has a very high death rate. So encephalitis is a big deal. Arbovirus, it is passed, encephalitis, believe it or not, is passed by both ticks and mosquitoes. So this is an outcome. Some with Lyme disease also can get what's called Lyme-induced encephalitis, which is more the deadlier type disease of this condition. And also it can cause by rabies and also by syphilis as well. Some of the examples was the West Nile fever that came about. There was also some cases, California encephalitis had an outbreak, and also yellow fever. Yellow fever was very known. Besides the blistering effects on the skin, usually could lead to encephalitis before antibiotics were to control some of these secondary infections. So encephalitis, believe it or not, from all the diseases we talked about, this can be caused by either a virus or bacteria. It can be either or. There is a vector control typically. Use a tick or mosquito repellents is the best way to defend against this. And there are some vaccines appropriate. Not all encephalitis that is caused do have vaccines, but some of them do that can prevent it in our elderly population or people that are going to travel to some of these mosquito-infested areas, the same as malaria. There is things that we can use to certain vaccines in certain parts of the country. Treatments, again, the vaccines I talked about, antiviral drugs, usually suppress the virus attack if you catch it early enough, as long as you don't have that much swelling of your brain. Supportive care, antibiotics for the different secondary bacterial infections, because when your brain's getting this storm, then you also have other secondary infections that occur, and maybe even your lungs. And also there is some of these encephalitis outbreaks, however, have no cure if you don't catch them early enough. So if you can't catch it with supportive measures, it can be a bad situation. All right, salmonella food poisoning, another thing. We talk about salmonella. A lot of times you talk about fish and we talk about chicken as some of this. This is a bacteria. And usually I was doing some research and they found that this can occur anywhere between 5 to 6 hours, but usually it's around after 10 to 12 hours of eating that particular food. However, it can be up to 72 hours. There are some mild cases where the numbers are low, that if your GI system doesn't clear fast enough, it can even take over a few days to occur. But most of the time, if it's a high level of bacteria, hi, Abby, how we doing? Usually the initial symptoms is usually after the food that we eat is brought about. The most common things are vomiting and then later on diarrhea. A more mild form, the ones that occur days, usually is going to be more of diarrhea. The early stages is vomiting, and the reason being our body has a trigger reaction. We're going to throw that up and get it out of there. We want to get rid of that bacteria. The stomach lining has nerve receptors. When you do that, you get spasms of the stomach, and you want to get rid of that food out of your stomach. And it can take quite a few times to throw up until all that will pass out of your body. But that's what food poisoning will be like. It's kind of explosive vomiting. Your gut is wrenching, and you're almost getting muscle spasms. Your body is so desperate to get that out. So figured to add a little bit of dimensions of description of that. I actually had a case of it, and I saw it quite a few times. So it is not fun. Well, it's what we call explosive vomiting. You can literally hit the other side of a wall sitting on a chair. And we used to see that in the emergency department. They would throw up. Neither a gallbladder attack is the same thing. They would actually hit the other wall when they threw up. So, all right. So it can be more symptomatic for younger kids and elderly individuals and anybody who's immunocompromised. People under radiation or chemotherapy, that's another problem with that. Something simple that most people will just throw up and feel lousy for a day and a half. Other people, it can cause severe illness. Contamination of food is usually handling and preparation. Most times you think of a picnic where somebody makes a potato salad or use some kind of food, a dairy product, and they let it sit out. Then they decide, well, half of my potato salad wasn't eaten. I'll put it back in the fridge and the family can have it another day or two later. That's like the perfect salmonella outbreak that can occur. Other cases are where meat products are left out in the environment too long when they're being cut or processed and they're not refrigerated properly. That will start growing that organism, and also contaminated tables that are treating both meat and vegetables. And that's why in some of these processing plants, it's better to keep meat products separate from vegetables. And one thing at home I will say to you guys is tell your parents to get a meat board for different raw meat and use a different board for your fruits and vegetables. And that's the best way to eliminate that. Even with, we have a lot of these boards now that can be washed in the dishwasher or the high temperature. I recommend those boards. Ones that are more porous are going to hold that bacteria if you're not running them in a high steam type washer or dishwasher, all right? Warm soaping water can help, but the heat of the water is probably the most important thing for salmonella and scrubbing it. All right. There are cases though with some of the outbreaks can occur from on reptiles, amphibians, rodents, and birds. These actually can be passed from different animals as well. And if they are in certain food markets where it's a cross contamination, this can occur with raw food compared with live food. So of course we all know how that works out. All right, I'm stuck here. So salmonella is a bacteria. I talked about that. There's no vectors. It passes directly to the organism. Safe food handling practices are the best way for prevention. And washing your hands after petting rodents, turtles, lizards, etc. And that's why when your mom says, hey, when you're handling, mammals aren't quite as much, but when you go into some of them, like I said, rodents, turtles, if you have a guinea pig, lizards, you're supposed to wash your hands because believe it or not, some of those animals can carry a low level of salmonella on them. Treatments for this is supportive care. If you start throwing up again and get severely dehydrated, you have to usually go in IV fluids. Most people, when they throw up, they get so dehydrated that you can't actually learn to turn. What happen is kidney shut down, or you get that dehydrated, and that can be a problem. So that's where a lot of times, if you're throwing up consistently or immunocompromised, you have to go in and get IV fluids to get your electrolytes back up. Antibiotics and anti-diarrheas should not be used. This doesn't help kill the salmonella. In fact, the antibiotics actually only kill the good bacteria in your stomach that help digest the food, and that's going to throw you off even more. So they really haven't been any studies that you can go. The only thing you can do is they keep you with fluids, supportive measures, and they monitor you in the hospital. That's all they can really do for you until it passes, all right? The complication rate is as such if you don't get treated. Most people that are healthy can make it through a salmonella food poisoning. Next thing is Lyme's disease. This is a huge thing, and this still isn't something I feel that we've gotten really a good hold on. We've learned so much about it, so much about the victor, which is the tick, how it grows and passes, but we're finding more and more diseases that this tick can cause. Not only just Lyme disease, I'm going to mention a few more, but it's unbelievable how this has gone up. When I was up in the late 90s, when I was up in upstate New York, there was a few cases that were just to the northeast of Pennsylvania around the Pocono areas, but most of the state did not have a lot of cases of it. Now it's all 50 states all over the country, and this Lyme disease is one of the fastest spreading things that we've seen. So, of course, it came out of the town called Lymes, Connecticut, where it spread, and it spread from there. And that's why we were seeing a lot of cases in upstate New York when I rotated up there. I worked with an infectious disease doctor that was seeing cases of it more than most of the region at that time because he had become an early expert on it. So it's transmitted by the deer tick, Ixodes scapularis, and the symptoms include chills and fever, headache, fatigue, muscle or joint pain, swollen glands, if it's left untreated. So the best thing I can give after a tick is there, and some of the myths were saying that if the tick is less than 72 hours, you don't have to worry about it. That's been proven false. They're now saying once the tick is on, within a short amount of time, once the mouth enters into the skin, they have a salivary type process that helps break down your blood. And the process of that salivary goes down through the tube of their feeding thing. Once that salivary goes in there, that has the bacteria in it. So if the tick has that bacteria, you have the ability to get the infection. And now some doctors are saying it can be a few hours that the tick's on. Now, if you have a tick just crawling on you and it's not embedded in your skin, that's not going to give you Lyme's disease. It has to be attached to your skin and for you to be able to get the Lyme's disease. But some of the new testing now is important, so I'll go over. But again, these symptoms, a lot of times you get fevers or chills within just like a few days of having it. And then from there on, the first symptom you'll look is the bullseye rash. And what that'll look like is it'll kind of have a center point, a clearing area, and then another dark area. So it's going to look like a little bullseye you throw darts at, and that's what it'll look like. The problem is not everybody gets that bullseye rash. In fact, the study down in epidemiologists down in Maryland felt that only for men, only 40% of men will ever get that bullseye, will actually have a positive test, and very few people even get that skin rash. And years ago, they thought that 80 to 90% of the people got the bullseye rash, and now we just disproved that most people actually aren't even getting the rash. So as we learn more about it, it gets further and further away. Again, as this deer tick, it gets on your skin, it passes it. This is a bacteria. All right, the deer tick is what spreads it. And the best thing is take precautions, wearing high socks if you have shorts on, using sprays. There's different sprays such that have DEET on, and there's some oil resistance. Nothing has been foolproof. It's amazing how this tick can jump above those areas, and in low exposure, it can even crawl through DEET. It's amazing how resistant this tick has become. The tick continues to adapt, and that's the problem to our common treatment. You want to check your body parts. You want to do complete searches when you're out. If you're out doing yard work, animals can bring them in as well. You want to make sure your animals sometimes even are careful on that. With it, cats don't get it, but dogs can. Something to keep in mind. And if you remove a tick, the best thing, blood tests only work because some people don't produce the antibodies right away. And again, I said for males, 60% of men will test negative for Lyme's disease within a certain amount of time after getting the Lyme's test. The best thing is to remove the tick is to use a kind of a sharp forceps. You get right where the head meets the skin. You do a little slight tension on it, and you pull the tick directly up. You want to make sure the whole mouth and head is up. You want to get that tick, you want to put it in a plastic bag, and you can send it to labs. If you send it to the lab, they can do an analysis to see if that tick actually has a disease. And if it comes back positive, I recommend going on the antibiotic if it was on your body. And that's our standard of care right now. Because if you wait for a positive test, you can develop secondary and third symptoms of ticks of Lyme's disease. The first stage is a rash. The second stage will be palsies, where you can get paralysis in your facial muscles, other muscles in your body. I've seen cases where literally the whole one side of the face will droop down, called a Bell's palsy. I saw some cases like that in New York. So it's pretty significant. Some other secondary stages then is arthralgia, where it's migratory type arthritis, where you get inflammation in different joints, and that migrates around. It'll be in one joint one day and another joint another day, and it can affect your large joints. And it can even lead to, again, different permanent nerve paralysis, encephalitis in some cases, and it can lead to cardiac dysfunction as well. So Lyme's disease is for that little thing, can be very deadly. So the best thing is prevention. When you're out hiking in areas, use these resistant things, checking your body, and making sure you're not getting the Lyme disease, and stay away high grass and high wood areas. Mills. All right. My wife's trying to drown me out from my lecture. All right.
Hey, Christian.
All right, so we're going to go to some. Yes,
Christian,
Charlie.
Can some of this be used on advancement for the ticks? For the new guys coming in, can that be used on their advancement?
In what sense?
I thought that was part of their first aid was knowing about ticks and how to.
Oh, it might be. I have to look. That might be one of the requirements. Sure, we can look on that.
Okay.
I have to check into that. If that, it might be part of like the first aid or something like that. Yeah.
Okay.
About the
Zach,
disease.
And who else is new?
Yeah, I have to look at if that's maybe in tenderfoot or something like that. I'll have to look on that, Charlie. Yeah, remind me on that. Then I'll have to check on that. Okay.
Right. Because some of this stuff is beyond or is above what they're doing, and I'd like to get it included in the part of their advancement.
Okay. Sure. Sure.
All right. Thank you.
All right. Sure. No problem. All right. So we're going to go over some other diseases now. We're continuing on. Now we're going to talk about, it talks about some of the conditions. Pick 4 of them. I'm going to go over pretty well anybody, different ones. We're going to just go over some of the more common ones. I'm going to pick just 4 of them. The West Nile disease, that's a virus that was transmitted by mosquitoes. And the interesting thing about that, one of our largest outbreaks within 2012, and it actually hit the United States pretty heavy. We didn't hear a lot of it. There was 3 states mostly affected: Arkansas, Michigan, and Mississippi. There was about 1,100 cases, and believe it or not, there was 41 deaths. They were concerned about that as being an epidemic. It never went to a pandemic because of the numbers, but it ended up fizzling out. But some of those areas, they ended up how to find ways of spraying for mosquitoes. It was basically to reduce the mosquitoes that was spreading it. One of the things is, again, prevention is also eliminate stagnant water, like any kind of mosquito disease, and also insect repellents. No disease treatment is available to prevent it. But also there is for supportive care. So a lot of times when they got this virus, it was like kind of like the flu. They had to give fluids and supportive measures. There wasn't any medicine that could stop it with it. And so that was kind of an odd disease. Botulism, that's an interesting term. This is caused by a bacteria that produces a certain toxin. There are no vectors. This is commonly from different foods, but also a lot of times it can from foodborne, or it can be actually from wounds, open wounds that are draining. Botulism can come from that. So in the wound care world, when we're treating these wounds, that is something that, well, we have to use universal precaution with it. So, and chronic wounds, war wounds that are draining, develop sinus tracts, believe it or not, they can get contaminated with botulism. Some of the methods of prevention is your food handling, proper wound care. When I'm treating wounds in my office, I use sterile instruments. I then get them cleaned. I use gloves in the same time, and I put everything down across the surface that prevents blood getting on the chair and other surfaces. Available treatments, antitoxin, supportive care, and antibiotics. Let's talk about influenza. As we know, that's what we call the common flu. It's caused by a virus. This is person to person, but this can also go aerosol droplets. There's no vectors. This is transmitted from person to person directly without a secondary in-between source. Best ways of prevention for this, like we're learning with the coronavirus, which is a more aggressive type virus, is hand washing, soap and water, scrubbing your hands, all right, social distancing, and also, there are some also cases where it can be spread from animals and birds. There's some of the more serious influenza outbreaks also did come from animals as well. Even though we wouldn't call them a vector, they were transmitted to humans, which then passed from human to human. Again, antiviral therapies can be used to shorten the intensity of it, but most of the time, again, it's rest, proper diet, and fluids in order to get through it. Pandemics and viruses, some of these flus have been pretty extensive. We're all worried about, of course, the coronavirus, which is the latest thing. But believe it or not, there's been some serious influenzas over the last few years. The one was a different one in 2009. That was a real severe influenza. It was a very different type of flu. Instead of affecting more elderly individuals, immunocompromised, it was seen on people under 55 and especially in kids. So this is why this was completely different than the other ones. This name was given a different name. It was called an H1N1 pod mode virus is what the different name was for that one. And they were kind of caught off guard. This one did start in the United States, believe it or not. And this was one. It spread around the world. There was, in the United States, there was 60.8 million cases of it in 2009, and there was 12,000 deaths. Luckily, it had a very low death rate, which was under 0.03%. So it wasn't causing a lot of death, but it was spread very well. And in the world, they estimated about between almost 500,000 deaths in the world. So even though it had spread, what they felt it might have affected anybody under the age of 65, up to 80% of people that had up to mild symptoms. They were never sure about it. So some of these epidemics we never really kind of paid attention to because the media just didn't really emphasize as much as they are this one with it. But I just wanted to bring that up as an interesting thing. Some of the other influenza's outbreak we talked about is 1968. That had a death rate of 0.03%, and the Spanish flu, which had a death rate of 1 to 3%, which is what we're looking at probably around 1%. Once we have all the epidemiology, we might find it might go lower, but that's where we're sitting around. So the Spanish flu in 1918 was pretty bad as well. That affected millions of people. All right. But I just wanted to spend a little more time on that. And last year there was about 31,000 deaths from the standard influenza. However, 2 years ago, there were 61,000 deaths in the United States from the influenza flu. So that's a good amount. And you're hearing that this COVID might cause up to 60,000 is the latest number. So it's going to be what the flu was 2 years ago. However, this one is currently more infectious. So that's why it's a little bit harder to control. All right. We talk about we'll skip over that. We'll go. All right, hepatitis. There's a lot of different forms of hepatitis. A, B, and C. Believe it or not, there's 5 types. It goes A, B, C, D, and E. We don't hear about D and E as much because they usually are in third world countries, and hepatitis D has to be transmitted with hepatitis B to cause infections. They're concomitant. They result together from contaminated water. Most of the ones we hear about is A, and then there's B and C, which is bloodborne. All right. This is a bloodborne pathogen. All the hepatitis are, and it's the precautions are blood and fluid precautions and proper food handling. Believe it or not, it can go on surfaces from blood of food and other surfaces. And the one thing with hepatitis, as opposed to this current virus, is you can't just simply wipe over a table. If there is blood, we have a whole different process in our office and other hospitals to get rid of that blood. You need something to break down the blood cells and to sterilize it and kill it. Hepatitis can be on the counters of tables in a blood form for weeks. So that's the one thing to keep in mind with that. Where this coronavirus, believe it or not, if it's on a counter and you wipe it clean, it's actually killed because it's encapsulated. It isn't stable in the outside environment. It's only stable in our bodies with it. But hepatitis is different with that. It's very infectious for long periods of time on wet blood surfaces. The available treatments, antiviral therapies, we'll talk about that, supportive care, and sometimes the self-limiting, some forms of it. All right. Basically, the 4 types of hepatitis, and there is the blood forms. There's also what's called autoimmune hepatitis, which your immune system attacks your liver. That is not from bloodborne, but is induced by the person's body. And there's actually also, but we're going to talk about, instead of secondary hepatitis, we're going to talk about the viral hepatitis. Hepatitis A comes from consumption of food or water. And that's important to know. When you travel to these third world countries, what you want to make sure is you want to ask the CDC where I'm traveling to what kind of diseases are in these areas. There are parts of the world that have contaminated water with hepatitis A. And if you drink it, you will get hepatitis A with it. Most of us now are vaccinated against hepatitis A and B. Among the younger kids I noticed, Lucas and Eli, they're typically immunizing against that. I had hepatitis A, but I had to get B when I was going through medical school to get immunized. And if you are traveling as an adult, look back. If you don't have immunization, you got to get that done. And that's usually for adults, 2 different shots over a certain amount of time. So you have to talk to your doctor before you travel to get those shots well in advance before you travel. And that's important based on what that country has. And the CDC has a website, what kind of conditions you need to be available. And a good infectious disease doctor, your immunologist will be able to help you with that if you're traveling. Hepatitis B and C is caused by blood or fluid contaminations. This would be from a needle stick, and it can be from blood transfusions if they're not properly tested. All right. And this is also from a virus. And the other thing, of course, is unprotected sex as well. Hepatitis B and C can be passed from because it is a virus and can pass through that. Okay. Treatment for that is we talk about is treatment A usually is self-limiting and it will go away with supportive measures. We don't usually have to get treatment for that unless you have some immune compromised condition. It's usually short-limiting. You usually have, if anything, some vomiting and at most some diarrhea. And with time, that usually goes away. Most kids get immunized between 12 to 18 months. That's usually 2 shots. And then adult can also get immunized if they haven't when they're a child. But that's a standard immunization now as a child unless you're selective on your immunizations. But I recommend getting immunized for that. Hepatitis B is treatment for that is there is antiviral treatment that has to be monitored. And the reason being is it takes months to sometimes years to go under an antiviral treatment for hepatitis B. That will stay in your blood and attack your liver for a long time. So you have to have a specialist test it and monitor that with blood tests because the medication can be very tough on your body with a lot of side effects and it can become toxic if you're not getting blood tests. It's also very expensive. So if you don't have good health care and you have hepatitis B and on treatment, that can be a problem too. Hepatitis C, again, antiviral therapies are used for that, as well. And in some cases, though, it can lead to significant cirrhosis, and the only thing that you can do at that point is then have a liver transplant. The difference of acquiring hepatitis, you can go on a transplant list for a liver, whereas if you're an alcoholic that resulted in hepatitis, it's harder to get a liver transplant unless you've been clean for a very long time. So hepatitis is something that may require a liver transplant. Important to know, there are no no vaccines for hepatitis C, just A and B, and that's important to know that we don't have any vaccinations for hepatitis C. So something to keep in mind. All right. So emphysema here, and we're probably coming down close to the wire. Emphysema. This is environmental. It's chronic exposure to toxic chemicals, long-term, and also tobacco use. This is one thing, smoker's lung, as they call it. You constantly smoke for years on end, this will result in emphysema. It falls under the chronic obstructive pulmonary disease category. Base way of prevention, stop smoking. Don't be around secondhand smoke, because secondhand smoke is just as destructive. And right now there's no cure. If you get chronic emphysema, there is no cure. You can do supportive things to try to maximize your lung capacity, but it usually will result in chronic disease of the lungs, and they won't regenerate. Supportive measures and also lung transplants. But again, if you're a smoker and you refuse to stop, you will never get a lung transplant. They won't allow you on the list for that. So that's something to remember. Meningitis, we talked about inflammation lining of spinal column. That comes along with encephalitis, and that's bacterial or viral. It's person to person, no vectors. Vaccination, some of the type of meningitis can be vaccinated, some cannot. Isolation and quarantine. Bacteria, for bacterial meningitis, that comes, treatment is antibiotics. Viral is usually self-limited. You have to be on, sometimes can end up in intensive care. You have to go on IV therapy and then supportive care. But at least with bacterial, antibiotics will work if you catch it somewhat early enough. All right, the one thing I thought was interesting, lead poisoning, that's environmental. This is caused by ingestion of lead, exposure to lead. You know, we talk about, Matt ate too much lead when he was a child, and that was one of the things that can cause issues there. So when young kids are chewing on toys, I know is the one thing we found out. Our kids like Thomas the Train, and the one thing we found out, some of the Thomas the Train engines were coming out of China using lead paint. So some of those toys that weren't being monitored was interesting. So if you had a kid that chewed on wooden toys or certain metal toys with lead paint, believe it or not, you can reach toxic levels if you continue allowing the infant to do it. So lead poisoning was something that over the years we learned more about, and that's why there's standards of care, what kind of toys for young kids they should not be exposed to. Lead paint has been eliminated in our country, but third world countries, that's not always the case.
Christian?
Yes.
So lead paint, my best friend has 3 kids. They had a house over near Dick's Dam that was, I don't know, built, it was pretty old.
Yeah, older house, sure.
Their kids, 2 of them tested for high levels of lead in their blood because they were playing on the porch. The porch was attached as like part of the house. They were playing on this porch, and the paint was lead paint. They had no idea.
Wow.
It's not like they're eating it, but because they're touching it, they're touching their faces.
Yeah, no, it's been shown not just eating it, but it can just constantly handling it is something. It's not as deadly as mercury, but lead, constant exposure to that, and they actually feel that it can be inhaled too sometimes. So that's one of the things, and that's a good point, Robinson. Thanks. So one of the turn it off there. Methods of prevention is identification at risk persons, environmental monitoring, and abatement. The treatments for this, for lead, we had some cases in the emergency room where they tested positive, and I think the limit is like something like 45 microns. It's a really low amount, but believe it or not, you don't need a lot of lead in your, and what lead will do, it actually can cause nerve paralysis and nerve damage, can lead to cardiac manifestations, and the different brain injuries as well. But what you actually have to do is admit the person what's called a chelation therapy. You actually add this chemical that binds to the lead. It breaks it down into smaller lead components that can be excreted by the kidney. Now, that has to be treated by a doctor because the process by treating, you have to measure the levels and then measure that they're able to pass it through their kidney. So there can be side effects with that chelation technique, but it can be treated, but you have to catch it. And again, the treatment sometimes does have some risks with it. So it's not taken lightly. And if you're not over that level, they usually don't do it for the risk. And in small children, that chelating technique is kind of, can be very, and usually a hematologist, a blood specialist will handle that if that treatment undergoes. And that's usually gets consulted on those kind of cases. But we did have some lead poisoning in the emergency room I worked at. All right. So that was some of the conditions. They talk about, we won't talk about the Zika virus. That was another virus. That's another thing. And that leads to your standard influenza type things. There was an outbreak, again, passed by a mosquito. So I don't want to emphasize enough, a lot of these diseases, the common thread, get rid of standing water around your house. These mosquitoes are annoying. They pass a lot of diseases. Now, we think some of these diseases go in third world countries, but in the cases, there can be a lot of things that can occur in our own country with mosquitoes. So the best thing, get rid of standing water. Don't let tires sit around and fill up. You want to get rid of those. Even little puddles, they can grow and breed in very easily. So the best thing is prevention for some of those things. Use your sprays, your DEET. There's some natural repellents as well that are out in the market that for some mosquitoes can work. There is some studies to show that you're a little more, certain blood types draw mosquitoes more than others. So sometimes in a family, some people get bit and some people don't. And that does exist. There are some studies that show blood types plays a role in that. And I think that's it for what I have to be able to cover over for this week. That was a lot of information. But that was good. You guys got to see a lot of different diseases that public health has to deal with on a common thing. And again, we're going to go into some of the more of those viral things and outbreaks a little more towards the end of the meeting. And I want to talk about the coronavirus, but for now, I wanted to talk about some of the things that are important for that. For next week, I just want to give a heads up before we close the meeting here. What I want you guys to cover is I want you guys to cover and read up on beforehand. Let me flip through here. We're going to be covering number 2, all right, which talks about your immunizations. What is immunization, how we're immunized. And that's A, B, and C of number 2. Then you're going to go over number 3 and number 4. Actually, number 4 as a vector, we already talked about that, so you don't have to worry about it. So that's number 2, number 3 in its entirety. I might be talking to my father-in-law, Tim. He was the supervisor of water treatment plant for a long time. I might actually talk to him to see if he'd be willing to go through and talk about the components of a water treatment plant because he's a pro on it. He was a supervisor for like 30 years. So I'm going to touch out the bases with him because right now there's 3 things we're supposed to visit a plant for different things. And I'm going to find either videos or way to get around that we can do it online. There's some videos I can show and do that. So that's one thing. So skip over number 5 at this point. And then we can go.
We can visit the Lake Meade plant.
Once we're allowed to be in a group, I just don't know when it's going to be, Charlie. So that's why I'm trying to come up with alternative measures right now.
I'm saying that we have visited the plant before. We can get permission to do that.
Yeah, and if we get that clearance from the pandemic, I'd have no trouble doing it. I'm just trying to come up with other options right now because there's there's different sites we can go. And I'm thinking for the one requirement, I might have us do a video and then maybe have him talk to the plant because he pretty well knows the plants inside and out. So it might be an interesting thing but I have to check with him. So we're going to do number 2, number 3, then we're going to go over to number 6, A, B, and C. All right. So that's what I want you guys to read over by next week. All right, number 2, number 3, and number 6. All right, that's what we're going to cover over next week's meeting then. Has everybody got that? I'll try to shoot something over to you, Tim, again, just to refresh everybody on those requirements then. And I'll see what we're going to do about the visitation thing. And number 7, we have an alternative for familiarize with a health agency's website. I'm going to have the kids probably do that, but that'll be probably the following week with that. All right. So just everybody maybe go over those numbers next time and we'll talk over that. All right. And that concludes for my part if Sam wants to close. Thanks to everyone.
All right, thank you, Christian.
Is Zach the only newbie? Laughman? I don't see anybody else, Tim.
Okay.
Zach, if you can work with any of your advancements with your grandfather or mother, okay, and you can call me up, and I can just verify that you did what you're supposed to do, okay? Zach? Your audio, there you are. Are you okay with that?
Yes.
Okay. I say we can advance you by working with the, you have your handbook. Just read over your scout and tenderfoot and see if there's anything in there you can get, you can do with your grandfather or your mother, okay?
And likewise, this is for everybody, is if you have advancement work that you are working on, feel free to either reach out to myself or any of the other Scoutmasters, and we'll be working through some of the stuff. We are also working on provisions as we get closer, those that need to go through Scoutmaster conferences and also to do border reviews. We're working on the final processes for that to be able to handle that remote also.
I do charge $20 though for my signature.
Is that in pesos?
No, that's worth it. That's definitely worth it.
All right. Any other leader announcements? All right, Scouts, remember, you need some sections of rope for some of the knots for next meeting. So that's also another one of the homework assignments. All right, if there's nothing else, then Sam, it's all yours. You have something, Eli? Guess not.
All right, thank you. Scout sign, Scout law. The Scout is trustworthy, loyal, helpful, friendly, courteous, kind, obedient, cheerful, thrifty, brave,
Clean and reverent.
Steve, do you mind leading us all in the Lord's Prayer?
No problem. Can you
Thank
hear
you.
me?
Yep.
Okay. If you're wearing hats, please take them off. And please join me in reciting the Lord's Prayer. Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done, on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. And lead us not into temptation, but deliver us from evil. For thy is the kingdom, the power, and the glory, forever and ever. Amen.